Good morning. So I am like, thanks for the intro there, Desiree, but nothing like a little pressure. So hopefully this will all be good. Again, like I said, I'm glad you guys are here today as well. The health and all policies is really, it's a really interesting concept, and one that I will preface with saying that seems pretty common sense. There's a lot of pieces, things that we'll talk about today that you'll think, yeah, I get that. I'm doing that. So as I told Desiree before we started, sometimes I feel like I'm preaching to the choir when I'm talking about a health and all policies approach, because it is something that we're familiar with the idea of, but perhaps don't know how to go about doing it. And it seems really overwhelming at first. So hopefully we'll get some good examples. I'm drawing pretty heavily today from a guide that was created for state and local governments about health and all policies. So that should help us out a little bit as far as like getting some examples to where we might just get started, or how do we start to think about it. So that's really what we want to do today in this short amount of time, because obviously we can't, you know, create a whole health and all policies approach in one sitting, but hopefully it'll get you started. So here we go. Okay. So today we're going to identify the 5 key elements of a health and all policies approach. And we want to discover the 5 promising strategies of this health and all policies approach. And then hopefully create an outline, at least a sketch. I'm going to kind of show you one at the end, a way to maybe take a little, something maybe broader that we'll talk about as we're moving through. And then as we go toward the end, when we get to those promising strategies, so there's a little couple things that we can do that are not necessarily the whole big key elements of that. And I'm going to sort of show you how that might, what that might look like, so that hopefully if there's an issue that you have, and I know that I put that in, you know, sort of with this class is going to be about, is that maybe you are already thinking about something, an area, an issue in your community that you know might could benefit from a health and all policies approach. So hopefully as we're walking through this today, you'll be thinking, okay, what would I include in that kind of thing, so that when you were finished with the day, maybe you do have some sort of rough outline, or at least know what your next steps might be, or what you need to look at. So there are a few things in the handouts that we won't necessarily cover here, but that I will mention and reference that you do have, that you can that you hopefully can use those things later. Okay, so, and of course we want to develop that list of indicators. Oops, back to go. So I just want to start just basically like defining like what is health and all policies. So really this is a collaborative approach to improving the health of all the people in our communities by incorporating health considerations into decision-making processes. So we're looking at policy areas, and we want to be thinking about, we know that our goal as public health professionals, we want our communities to be healthy, right? But sometimes we don't always have the policy levers to make that happen. So when we're talking about a health and all policies approach, it's really a matter of those of us who are public health professionals coming up with a way to look at the big picture, to look at the issue and see where there might be some policy options. And then we want to be able to start to think about what that would look like, and then get those decision makers on board with us, right? Because again, a lot of times we're not the ones that are making policy. We're not the ones doing the decision making, but how are we going to start plugging in with them, right? So we're basically learning to become policy advocates, right? We want to take these issues and we want to say, okay, here's the kind of things that will help. And when you take this collaborative approach, what ends up happening is that you're working with multiple entities across the community, and so you get more buy-in. And then it makes it a lot easier to get those policymakers, decision makers on board with making those kind of changes, because it's not just the one group necessarily, just your health department, you know, just your public health officer that's fighting for these things, that you have some collaboration going on. So again, the goal of health and all policies is really to ensure that all decision makers are informed about health, equity, and sustainability consequences of various policy options during the policy development process. So what we're trying to do is get in on that ground floor to make some changes. A health and all policies approach identifies the ways in which decisions in multiple sectors affect health, and how better health can support the achievement of goals from multiple sectors. It engages diverse governmental partners and stakeholders to work together to improve health and simultaneously advance other goals, like promoting job creation or economic stability or transportation access and mobility, a strong ag system, environmental sustainability, and educational attainment. So it's the gamut, right? It's how do we say, okay, if we want healthy communities, what are all the things that we have to look at? And can we do those together? And where are there things going on that maybe we've taken a siloed approach and multiple organizations or entities are working on that? And how can we come together? Like, where are some things that are already existing even that we might be able to start to pull in from? So that's kind of an important part for that. And so Health in All Policies really builds on this long public health tradition of successful intersectoral collaboration. So things like implementing water fluoridation or reducing lead exposure or restricting tobacco use in workplaces and public parks, improving sanitation and drinking water, reducing domestic violence, all of these things, seat belts, car seats, all these things are that kind of health in all policy approach that are pieces that are farming into that larger picture. So there's a wide spectrum of activities that can be considered health in all policies. Sometimes it is a one-time collaboration. That's kind of on one spectrum. And then it's the whole of government approaches involving ongoing collaborations are kind of at the other end of the spectrum. So you're going to see today that there are times when maybe you just want to jump in and get going on something, but you're looking at a larger picture that hopefully at some point really incorporates all the pieces, all the moving parts. And so again, the best thing we can hope for is to move towards that right side where all of our governmental policies are thinking about, is this doing good for public health in general, right? So when they go past that, then we know that's a really good thing. So of course, then the question becomes, why do we need this? Well, because everything has to do with health, right? It's really a response to a variety of complex and often inextricably linked problems like chronic illness, growing inequality, health inequities, rising healthcare costs, an aging population, climate change, other threats to natural resources, and the lack of efficient strategies for achieving these governmental goals when we have shrinking resources, right? We all know we're trying to do more with less, and we have bigger problems, and they're growing exponentially. And so it's really challenging for us. And so to do that, we have to come up with some innovative solutions and just kind of switch our way of how we think about policy and how are we going about all of these things that we know that are linked together, and the structures that break down those siloed nature and then try to advance this transdisciplinary and intersectoral thinking, and health in all policies lets us do that. So governments at all levels are challenged by declining revenues and shrinking budgets, and they also face these super increasing complex problems. And so this collaboration exists sometimes, but really it's our goal, like I said, as public health professionals, to move that needle forward. Okay, so that's really what we want to think about and foster what can we do to help them, right? How can we explain to those policymakers why this kind of approach would be beneficial, not just in health, but across all kinds of economics and educational and just overall health of a community. We can do that. And also that we can potentially decrease costs and get better outcomes, right? And still doing those kind of things. So let's talk about some of the key points in health in all policies, okay? So health is influenced by social, physical, and economic environments that we collectively talk about as social determinants of health. And I'm sure most of you are familiar with that, but we just want to make sure everybody's on the same page here. So at its core, we really just want to address these social determinants of health that are really the key drivers of health outcomes and health inequities. So health in all policies really supports improved health outcomes and health equity through collaboration. And it's between public health practitioners and then our non-traditional partners who have influence over those social determinants of health. So we can recognize problems in public health. We see it in our communities with those we work with the programs that we're part of and that we're doing. But then how do we work with other people outside of that? Sometimes it's our policymakers, so it's at that governmental stage. And other times it's who are those non-traditional partners within the community that might benefit them to take a health in all policies approach that can be effective. And we're going to talk about things like co-benefits and win-wins as we move forward here. So, and it also encompasses a wide spectrum of activities and can be implemented in many different ways. So today I'm going to give you some elements and then some promising practices, some strategies, but there's no right or wrong way to do this. you really just have to figure out like where you're at in your community and who your potential partners might be and what that might actually look like as you're starting to think about collaboration. So it's not just, unfortunately, it's not just a roadmap that says if you check these 5 boxes, we're going to end up with a health and all policies approach on the other side. Okay, so just a quick review here of these social determinants of health. If you look at our little spectrum, education access and quality, healthcare access and quality, neighborhoods and the built environment, social and community context, and economic stability. Like those are the things that we're really thinking about when we're talking about the social determinants of health. And all of these things really impact the way that our communities are healthy or not. And so we have to consider the policies that we're making. If we want to be a healthy community, how are we working with this group of things to make those kind of things happen within our communities and across communities? So really that core piece of it is it represents an approach to addressing these things, the social determinants of health, because they're the key drivers of health outcomes, but also health inequities. And it's founded on the recognition that public health practitioners have to work with partners across lots of different realms to influence these social determinants of health, which are largely outside the purview of public health agencies. So when we're looking at a lot of these things, we're thinking, okay, but that's not what we do in our health department. We're not talking about healthcare access. How are we supposed to fix economic stability? How are we supposed to do these things? And that's part of what we have to learn to do is kind of work across there to say, okay, wait, where are the experts in those things, and how can we work together to have this health and all policies approach by incorporating the things that we know contribute to less healthy communities, okay? So we're going to talk in just a minute here about the difference between inequities or disparities. So one of the parables, and probably a lot of you have heard this, is the idea of the upstream parable, right? You wander along the road and you see somebody in the water, and so you get out and you help pull them out of the water, right? And then a few minutes later, here comes somebody else and you go to reach and pull them out of the water. And you keep doing this, and there people keep coming and they're down the stream. And what happens all of a sudden is at some point you ask yourself, how are they getting in the stream, right? So you have to go that upstream approach and think, where is the root cause of the problem? So we'll talk about that a couple different times today. And so really what we want to think about is this. If we know the problem is here, where does it start? And that's really a huge component of health and all policies, is backing up. How do we ask ourselves the question, if we ended up here, how did we get there? And how did the majority of the people who have this issue get to this point? And so when we start asking the question backwards, we can get back to that root cause, and that might be the place where we can actually want to be plugging in a policy at a more preventative state rather than taking care of it once we get to where it's a huge issue for us, okay? So of course, we know that health is influenced by the interaction of lots of different factors like genetics and biology and behavior and access and barriers to healthcare, social, economic, and physical things, the natural and the built environments. And we really want to talk about, we talk about access to healthcare. A lot of times we say, well, that's the big problem, that's the big barrier. But really, even though clinical care is really important, only a small percent of your overall health, like 15 to 20% statistically, can actually be attributed to clinical care. So all these other things, all the other social determinants of health that we're talking about actually have a far greater impact on how long and how well people live rather than just medical care. So that interaction between health, social factors, and environmental factors is really complex. And so it's hard. Like I said, the concepts that we're talking about today are relatively simple, but putting them into practice is a totally different thing, right? And I think that's one of the big things that we have to say is that we don't want to jump in, right? We want to learn how to take a step back, backtrack to those root causes, and then look at what are the potential policy options that could help us have healthier, more well communities overall. Okay, so a couple different definitions here, and then we're going to do a little quiz. So health inequities are just differences in health that are a result of systemic, avoidable, and unjust social and economic policies and practices that create barriers to opportunity. And if we're talking about health disparities, those are differences in health status among distinct segments of the population, including differences that occur by gender, race or ethnicity, education or income, disability, or living in various geographic localities. Okay, so this is the two differences. I'm going to give you a couple minutes here, or just a minute here, to look at the two definitions. And then we're going to look at some examples, and you guys are going to get to say whether you think those are health inequities or health disparities. Notice we had we're almost 60-40 here as far as whether or not that's a health disparity or a health inequity. So increased rates of asthma hospitalization in children living near freeways, that is actually a health inequity. That's a health inequity, okay? And number two, increased risk of sickle cell disease in Black Americans, that is a health disparity. So overwhelmingly, we looked at that one. And number three, the increased risk of breast cancer in women, that is a health disparity. So there we go, we're getting there. And then our last one, lower life expectancy for Black Americans living in low income neighborhoods, that is a health inequity. So we see that the majority of you thought it was that. So just some things to think about, like what are the differences? And it's, it's important for us for terminology purposes. And so really health in all policies is looking at these things that are health inequities, okay, the health inequities. So there are differences in health that result in systemic, avoidable, and unjust social and economic policies and practices that create barriers to opportunity. So that's what we're doing as far as that goes. So let's see. Close that poll. Can we still see the screen that I have up? Is that okay? Just want to make sure we're all still on the same track. Okay. Let's move to those social determinants of health. So as I mentioned, social determinants of health are these key drivers of health inequities, which are persistent in the United States. Health inequities, we know that we just gave the definitions for the two of these things. And so when we're looking at this, some of these things we have to focus on. So the first one we want to talk about is like the economics. So economic well-being is one of the most critical determinants of health. Living in poverty is associated with significantly worse health outcomes across all races and ethnicities and in every state and in every community. So unemployment is associated with poor physical and mental health outcomes. And we know that poverty damages health over the life course. Key elements that come from that are inadequate financial resources, diminished early life environments, poor educational opportunity, physical environments that are dangerous or under-resourced, poor working conditions, absence of benefits, job insecurity, lack of health insurance. All of those things come from this economic driver, okay? So we really want to think about what can we do, what kind of policies are we putting into place that will potentially be what we consider economic policies that will have an impact on health, okay? Because there's just so linked. And the another one is education. And this is another key determinant of health. Education and health correspond closely, and they impact each other actually in both directions. So we don't want to look at that causal going from one way to the other. It's actually both. And we can see this because we know that people with higher levels of educational attainment consistently experience lower risk for a huge array of illnesses, and they have an increased life expectancy. They also experience improved future economic well-being. But on the other side of that, educational attainment itself is shaped by health. So think about it this way, like students, the health of a student significantly impacts school dropout rates, attendance, and their academic performance. We know if those little guys are not getting a good breakfast before they show up to school, that's going to impact their educational attainment during the day and then eventually into their future, right? So how are we getting to make healthy kids that can provide them with these educational pieces so that we know that eventually they can get to that economic situation that will then help them be healthier over the course of time. We also can't talk about a health and all policies approach without looking at the idea of structural racism. And this contributes to persistent inequities. These are things that we can fix. These are things that our policies from the previous 247 years have done to continue to keep people from reaching a better goal, whether that is life in general or health policies overall, right? People of color have consistently lower incomes. They have less household wealth. They have lower educational achievements than whites. And we know this. Children living in poverty are more likely to be Hispanic or Black American. even at equivalent income levels, so if we're comparing people who make the same amount of money, people of color consistently experience significantly higher rates of illness and injury than their white counterparts, right? And that's the way our policies are structured, is kind of like that. And part of it is that we contribute to this idea by the way we go about policy. So here's another little parable for you. It's called The Gardener's Tale. And so this really talks about how structural racism impacts the outcomes and perpetuates those inequities over time. So imagine this. Imagine a gardener has 2 packets of seeds. One is for red flowers and one is for pink flowers. And there's 2 flower boxes that you can plant these seeds in. One has poor soil and the other one has rich soil. The gardener really loves red flowers. Okay, red flowers are the gardener's favorite. So the gardener obviously is then going to plant the red seeds in which box? Obviously the one with the rich soil, right? Because if you love the red flowers, that's where you're going to plant those seeds. And you're going to put the pink flowers in that poor rocky soil. So we all know the outcome of this. The seeds in the really good soil grow really big and beautiful flowers. And the pink seeds in the poor soil don't do so well. And they don't look very good. And as the seeds self-sow in the boxes, the red flowers in the rich soil continue to thrive and the pink flowers are struggling. And so, of course, then the gardener looked at this and said, see, I was right. The red flowers are better. And that's not the point. Is you specifically took that group and put them in a disadvantage, right? So how can we get it to where all the flowers are in some sort of better soil? Because what happens is we're seeing at the end the red flowers and the pink flowers and what they look like. And again, go back to the root cause. How can we get it to where everybody has a rich soil to start with? Okay, so that's really what we want to start to think about as far as that goes. And then the last kind of piece we want to talk just a little bit about here is neighborhood characteristics, right? They have significant impacts on health outcomes because they influence an individual's ability to adopt behaviors that promote health. Efforts to change behavior that impact health are most effective when they also address the environments in which people make their daily choices, right? So, and I know a lot of you are in rural communities, and so we know that we're talking about like maybe access to quality food. There's no grocery store. We're living in a food desert. Like maybe there's not parks or community gardens and things like that. So, but even in, you know, urban areas, we have these kind of issues because there's lack of green space and trees and or high crime rates, or there's not safe places to play or to walk. Low income neighborhoods often have less access to that healthy food options. And we know the alternative is that cheap fast food. And so how do we create policies that don't make that our go-to, right? So serious health problems are highly concentrated in a fairly small number of distressed neighborhoods if we're talking about urban areas. And the health problems of high poverty neighborhoods remain substantially more serious than those of the middle class and affluent neighborhoods. People living in neighborhoods with high rates of poverty can have life expectancies up to 14 years shorter. So we really have to come across like, how are we working in these neighborhoods and these communities that are super disadvantaged, because it's going to make a difference. And it's going to cost us a lot more money in the long run if we're trying to take care of them down the road. That's going to be less money that we can spend on helping the community as a whole, right? So these inequities in part reflect differences in characteristics between neighborhoods with high levels of poverty and those where we're looking at the more white affluent. So the studies are showing us that these residents are most likely to lack access to supermarkets and healthful food, less parks, like I said, more fast foods. And so racial segregation is also an issue for some of us in some communities. And if we have that going on, that actually just contributes even more to some of these health inequities. So there is a framework in your packet that's called, let's see, there's a framework that was developed by the Bay Area Regional Health Inequities that shows how the social determinants of health are linked with poor health outcomes. So you have that to kind of look at later as just a little framework to think about, okay, what are we doing in our communities? Where do we have some of these disparities? And what are our main focuses as far as trying to go forward in making policies that work for those? Okay, so we want to talk a little bit about sustainability and economics. So we're really looking at environmental sustainability when we're talking about this. Environmental sustainability is inextricably linked to health and equity. and has an important place in a health and all policies work and approach. So global environmental challenges not only directly impact health, things like flooding, extreme heat events, but they also threaten the support systems on which human life depends: air, food, shelter, water, right? So the effects of air pollution, crop loss, ozone depletion, sea level rise, all of these things, and suggest that environmental sustainability must itself be a key health goal. And again, I think this is something that we recognize, right? As public health professionals, we are really realizing how much the environment impacts everything else that's going on as far as health outcomes. But we also know that we don't have all the politicians on our side when it comes to that, right? And we're still having this debate about what we should be doing as far as climate change and the environment. And part of what we have to learn how to do is be able to communicate that each of these pieces in the environment impact the health of our communities and their ability to go to work, their ability to be healthy, their ability to sustain themselves for a long period of time. That's not going to contribute to the overall healthcare costs of our country and globally, right? And so a lot of times when we're talking about a health and all policies approach, we might actually be dealing with environmental strategies, like what is the natural, the built, the physical environment. And so we want to look at kind of those things and how do we embed those into the policies as we move forward. And the other thing that we have to talk about is, again, back to the economics, right? The population's health impacts, they're impacted by the economy in multiple ways. Like right here in the United States, we're talking about the rising cost of healthcare. It's roughly 18% of the GDP. It's sapping our government's ability to invest in other critical areas like education, renewable energy, and our deficit reduction, which is of those trillions of dollars spent on healthcare each year. 75% of that is on chronic conditions, which I think is probably not something new to you. And nearly 10% of all national medical costs are obesity related. Cardiovascular disease alone costs society nearly $400 billion each year. And it's estimated that an excess of $180 billion is spent annually to treat uncomplicated diabetes and hypertension. So we're spending a ton of money to do these things rather than working on prevention of these chronic illnesses. So the numbers don't lie. We could really save a ton of money just investing in each person. So we can look at like a $10 investment per person that gives us such a rate of return that's insane. I mean, like we're doubling our money back is what happens. Okay, so we really want to start thinking about the economics of health, which I know a lot of you are like, I didn't get into public health to do economy, right? Most of us are not econ people. We know it goes up and it comes down, and it goes up and it comes down, but really that overall economic well-being of a country and of the people who live in that, if we're not making health policies that are taking into consideration the economic factors, and that's how we make a big selling point, right? When we can use some of this data to show our policymakers that this amount of money spent is going to save us this much money later. And we sort of have to start thinking about how can we make those numbers work for us when it's coming, to all of those pieces. Okay, so what's really great is that people in general are starting to realize this. So across the political spectrum, we know that spending money to improve the health of communities makes sense, right? So even in places that are very conservative, people are saying, yes, we understand. We understand that health is important to our economy. We understand that the economy is important to our health. And so hopefully, as we move forward, we can start to think about how those kind of things might work. So let's just think of an example of the need for health in all policies. And again, I'm hoping that this is a place where you have maybe thought of an issue in your community, something that's really prevalent that you might want to be thinking about as we go through today and talking about the different pieces of this health in all policies, like what is something that you care about. So for me, today, what we're going to use is, and only because I'm going to switch it up for us and show us a little something different at the end. Obesity, right? Obesity is definitely an example of the need for a health in all policies approach. So the causes of obesity epidemic are complex, including food, physical activity, social, economic environments that shape individuals' opportunities to make healthy food and beverage choices and incorporate exercise into their daily routines. So we know that more than 1/3 of adults and almost 1/5 of children in the United States are obese. And obesity rates have more than doubled for adults and tripled for kids since 1980. Now that's pretty quick change, right? We know that changes don't occur that fast normally. And of course, obesity rates increase the risk of lots of different health conditions like coronary heart disease, stroke, high blood pressure, type 2 diabetes, cancer, lots of different things, even infertility. So it also is shortening our population life expectancies for future generations. We don't know the numbers on that just yet, but it's coming, right? If we're talking about the increase from 1980, we're going to really start to see the effects of these life expectancies changing. So the increased prevalence of sedentary lifestyles, which contribute to rising obesity rates, is related to changes in patterns of land use and transportation, increased distances from home to school and work, parental fears about children's safety of being outside by themselves, shifts in the nature of work. All of us, we're on a Zoom call right now, right? So those kind of things shift in what we're doing, and just culture changes in general. So we're also increasing consumption of foods and beverages with high calorie density and little nutritional value. And part of that is for time savings and processed convenience foods, or pressures on working parents, or the ability to buy fresh fruits and vegetables or have access to them. Government subsidies for things that are not necessarily good for us. So if we want to reduce the prevalence of obesity and chronic disease, we're going to have to look at addressing people's environments, which is going to in turn require working across multiple sectors. So this is a perfect opportunity for like a health and all policies type approach, because we would have to include things like transportation, planning, agriculture, labor, economic development, education, entertainment. And we could just think of a slew of different partners that we could have to do to take some sort of comprehensive approach to obesity and chronic disease prevention. We're also going to have to look at the links between this and environmental sustainability, as well as addressing the inequities in how communities themselves are impacted. So we understand it's a problem. We know we've got to work with a bunch of different sectors, but hopefully what I just said 2 minutes ago made you realize that that's huge. Like I just mentioned every single possible realm of factors that might go into this obesity epidemic. We can't just say, oh, get more exercise, oh, eat healthier. That's not the answer to the question of how do we actually deal with obesity. And so it's a huge problem, and one that we have to take a step back and look at, okay? And so let's talk about what actually are those 5 key elements to a health and all policies. Okay, so as I mentioned at the beginning, there's no right way to implement this kind of approach. They're based on the concept that population health and equity depend upon this collaborative intersectoral action. There is substantial variation in the process, the structure and scope, and the participation. Who is going to be involved in this, and who are you bringing to the table? And all these things depend on many factors, including the needs of your particular community, what resources you have available, and your relationships with those key partners. So regardless of how you're doing this, there's a wide range of activities that governments can use to promote consideration of health in their decision-making process. So these activities can be seen as falling along that spectrum that I talked about earlier. Like, is it a one-time collaborative approach, or are we moving towards something that's more consistent across fields like we would need to do to talk about the obesity, okay? And so the first thing that we talk about, health and all policies promotes health, equity, and sustainability through 2 different avenues. The first one is incorporating health, equity, and sustainability into specific policies, programs, or processes. And the second way we do that is embedding health, equity, and sustainability considerations into government decision-making processes so that healthy public policy becomes the normal way of doing business. Again, the big piece of this is getting this paradigm shift to where policymakers are understanding that the policies that they make need to consider the impacts on health, which is really, it's kind of a strange concept. It's not to public health professionals that we want to create these policies that make healthier communities, but we know that for some of you who have worked with the politicians and policymakers, you know that that's not necessarily their first go-to, right? That's not the first thing that policymakers are thinking about is, oh, how do we create healthy communities with this economic policy? Is this tax cut really going to help somebody have access to healthier food? So we need to be there on the other side of that as policy advocates saying, look, when you make these policies, you're actually either making it better or you're making it worse as far as the health of the whole community. So the second one, jumped right ahead there. The second one is supporting intersectoral collaboration. So Health in All Policies brings together partners from many different sectors to recognize the link between health and other issues and policy areas. We want to work on breaking down those silos. A lot of us know that there are several different entities working on one particular thing. And that lack of communication and cooperation together means that we're not really getting to fix the problem, right? We're working on these things individually on maybe separate pieces. And what if we came together as a whole and said, hey, you know what? You're working on this drug problem and you're working on this. What if we paired these things together? And then we could save some time and some money. And a lot of you have done this kind of thing with in your health departments that use like a hub and spoke model, right? Where you're saying, hey, we need this particular program. Can we have one centrally located that we can push these people out to different areas? So part of it has to become that kind of thinking in that intersectoral collaboration. And we're going to see how sometimes that means within our own health department. Sometimes that's going to mean across health departments, things that are already established. And sometimes it's going to mean working with people like inside our communities that maybe we've never even thought about bringing in on our policy type approach with this. So this kind of approach focuses on the deep and ongoing collaboration rather than just taking a superficial or one-off approach to make this happen. So really big on these partnerships. Here's this co-benefits for multiple partners. It's built on this co-benefits and win-wins. So Health in All Policies work should benefit multiple partners simultaneously addressing the goal of public health agencies and other agencies to benefit more than one. That's the achievement of the co-benefits. And we want to create efficiencies across agencies. What we're trying to do is find these win-wins. What is good for us and good for them, right? This concept is essential for securing support from partners, and it can reduce redundancies and ensure more effective use of scarce government resources. So if we find a balance between these multiple goals, and sometimes that can be really difficult because you know how it is, right? If you have something that you want to take care of, like you want it to be all in for whatever's going to be the win for your side, right? And if you're going to work with a partner, they have a different agenda. They're coming at it from a different way. So part of it is this balance. How do you work with other partners where everybody's going to get something, but we're also going to have to learn to cooperate with one another. And it can't just be about like our best interest, our department's best interest. What are we doing to think, okay, but I understand their piece of it and how are they coming from it that way?
Trisha?
And we can't talk, yes?
You have a couple of questions in the chat box.
Oh, okay.
So is now a good time, or do you want to get those later, or do you want me to read them? So Julie and Meg both had questions.
Yeah, I'm looking here. Through.
And everybody, I uploaded all of the documents Trisha was referring to earlier into the chat, so you can find the documents there. But Meg's wondering if obesity, is obesity the current equity goal?
Right. Well, and again, so when we're talking about it from public health perspective, as far as making policies, like we're trying to create a fact that we know that people are not healthy overall, right? That obesity has increased substantially in such a short amount of time. And this is not about calling out people. This is not about saying you need to do these 5 things. This is about us creating policies that would allow people to have access to the things that they need to just be a healthier person. This isn't about like a weight goal that says, oh, we need to get you down to this size or this BMI approach. It's not, we're not coming at it from a clinical perspective, right? So as far as the equity goal, what we're saying is that people who don't have access to all those things are becoming less healthy over time. And what can we do as far as policies go to give people opportunities to be able to make changes in their lifestyle that they can afford to do that will make them overall healthier, rather than saying like, oh, now you're at this perfect weight level, right? So we're really looking at this, a health at every size approach, but see that would be this, right? Do you have access to fresh fruits and vegetables? Do you have access to a place to go to a park to exercise? Do you have access to nutrition? Exactly, right? So access to healthy nutrition, sleep arrangements, perfect, physical, exactly. All of those things are what we're talking about in a Health in All Policies approach. And actually we're going to see, and that's why I started with obesity as this big thing, because what we want to do is say, okay, wait, if that is the whole overarching thing, where can we start to plug in at? And so I'm actually going to talk at the end when we get to the promising strategies about just some of the basic built environment like sidewalks and lampposts, things that we think, wait, what? Because a lot of it is no access to all of those things that Meg actually just mentioned. And so how can we go about making policy changes to all of this stuff? Because that's the point. Obesity isn't just like oh, let's do this and we fixed it, right? What it is that we all need to be more healthy. And how are our communities keeping us from doing that? What kind of policies are policymakers putting in here that are actually hurting us instead of helping us, right? And so that's really the goal. We can say, okay, well, here's the issue, but what do we mean by that as far as a solution to the problem that allows everybody to get rid of the inequity? We want this equitable measure. We want things that are basically that are good for everyone in our communities, and they're not just potentially keeping people from getting the things that they need. Okay, so let's hop back over here to engaging those stakeholders. So we're going to think about the community members, policy experts, policy advocates, members of the private sector, funders, people who can help us get money for funding for things. Robust stakeholder engagement is essential for ensuring that work is responsive to community needs and for garnering valuable information necessary to create meaningful and impactful change. So we're going to have to work outside of our public health professionals, but we need to include them as well. But we also want to make sure we can work with the people in our communities. So we also want to talk about health and all policies creating permanent changes in how agencies relate to each other and how government decisions are made. This requires maintenance of both structures, which can sustain that collaboration, and mechanisms which can ensure a health and equity lens in decision-making processes across the whole of government. This can be thought as we talk about embedding or institutionalizing a health and all policies within existing and new structures and processes for government. Okay, so if we're looking at these things, if we're talking about how to create healthier communities, right, we're going to need to address people's environments. So we're going to have to look at transportation and planning, agriculture, labor, economic development, education. All these other partners we're going to have to look at to have this comprehensive approach for health and all policies, right? And how do we get to where we are lowering our chronic disease? How are we preventing that from happening in future generations? And how can we link across these sectors and keeping in mind our environment, right, while we're doing it? And what are those inequities? That's a really big piece of this, is what is the inequity that is keeping people from having access to the things that they need to be healthier overall, okay? All right, so how do we think about getting started for this? One of the things is, if you have a broad vision, windows of opportunity for health and all policies are everywhere. So if you just step back and think, okay, where can we kind of plug in and start making our communities healthy? How can we do this? What are we missing? What are we not doing? Where is a window of opportunity that we might be able to do that? So the next thing is the activities in which governments already engage and the roles they take on can give us those opportunities. And health and all policies can be used across the whole of government and can also be applied to specific policies, programs, and strategies. So how do we do that? How do we find opportunities for change? So anytime you're thinking about a health and all policy initiative, it's going to require significant visioning, planning, and decision-making. Unless you have been explicitly mandated to do a health and all policies approach, which sometimes we have that, but not always, your initial step might just be to find an opportunity to introduce this kind of approach, right? So where is that at? So it might be in the form of a willing partner from outside public health. It might be a mobilization around a specific community need, or a great idea for how to embed health into a process or a program in another agency that's not actually focused on public health. Even if you're directed by a piece of legislation or an executive order or some other type of mandate to carry this out, there's going to inevitably be room for a creative process to discover opportunities and invite partners and select priorities while implementing this kind of approach. So the first thing you want to do is share your vision. If you can have some sort of vision of a healthy community and you are willing to work with other people outside of public health, you're going to continually come across opportunities for positive change. It's important to talk about your vision in order to help others see that potential that we could achieve. And much of the work about this health in all policies is having an idea and sharing it. Seems pretty basic, right? But where are our opportunities to do this? As people become more aware of the importance of this approach, the opportunities you'll be provided because people will start to think like this, right? Like, let's say you had your whole agency even thinking about how do we plug in to do health in everything that we're doing? Are we doing that at the health department level? And then how can we mesh that with other pieces in our community to make it sort of a difference, right? So how are we coming up with this? So windows of opportunity. At any given moment, most governments are discussing or implementing hundreds of issues, processes, and initiatives in all kinds of policy areas, many of which would actually offer us opportunity to promote health. So what these windows of opportunity, for those of you who might be familiar with John Kingdon, he talks about these as policy windows. So like there's a brief period of time where a policy window will open and you can get that through, right? Like we can get this changed, but all the little pieces have to come together. The policy process, the politics piece of it, what is the problem? When all of that comes together, then you get a window of opportunity. And so it doesn't happen very often per se, and you got to be ready. Okay, so sometimes you might have to wait to be able to get something implemented, and you rarely have control over the timing of these windows, so you've got to be looking for them. Okay, but they can really provide you for this. I think, let me see. Oh, let's go back. So there's really three approaches when it comes to this, and this comes from the World Health Organization. There's three approaches to this intersectoral action on health. If you're taking an opportunistic approach, this is when you focus on identifying issues, policies, or relationships that can potentially provide early success for all partners. So like, what's something that we can do real quick? If you're looking at an issue approach, this starts with identifying policies that have a major impact on specific public health priorities, like violence prevention or reduction in poverty. And then the last piece is like a sector approach, which focuses on one specific policy area that has a large health impact, like transportation or agriculture. In fact, both the issue and the sector approaches can be enhanced by exploring these windows of opportunity. Okay. Now, there's a few things, and I did put this again in your handouts as you're starting to walk through how you might do this health in all policies. And I took those from that guide they're called food for thought. So these are just questions that you can ask yourself when you're looking for opportunities for a health in all policies approach. And so for the different stages of things we're talking about today, you'll see that there's a lot of different questions that you can ask yourself. So I thought those were very beneficial to where we can stop and say, okay, like what? For instance, like, are there existing or newly formed interagency initiatives that have potential health implications? What kind of single agency initiatives would benefit from a partnership with other agencies? Are you guys going through a strategic planning process right now where you could maybe work with a different health department to see what's working for them that might be working for you? What partners have you worked with successfully in the past? Have you done so? Is there an opportunity for you to be doing that? Is there a particular health issue that's concerned with a specific community group? Maybe that particular community group could be helpful in helping to facilitate some sort of new policy or program that would be beneficial to that group as a whole, especially if that is a group of people that has experienced some kind of inequity in the past, right? So those food for thoughts, again, they go with basically everything as we are moving through. So I put them all in one document so that you can have them to reference later. So one of the initiatives that I thought was interesting, just kind of like outreach, this is an example that sometimes we can take a public health program that are already providing us with opportunities to link to other agencies with that social determinants of health. So in California, for instance, the Contra Costa County Public Health Department, they launched a program to help their WIC recipients understand the income tax process. What? Now, if we're thinking about this, why would the health department take their WIC recipients and want to walk them through the income tax process? Well, the answer is because they were teaching them how to apply for the earned income tax credit. Because they were already coming into the health department, there was an opportunity to bring in some tax professionals to show them, because they found out, they did some research, right? And we know economics is really tied, right, to how you are as overall healthy. And so they were saying, okay, and they started asking questions and saying, are you getting your earned income tax credit? And they were saying, what's that? Right. And of course, this was before we have all the little internet. Most people had to fill out the short form, right? And so people who were not paying someone to do their taxes were missing this earned income tax credit, which would be a huge benefit to all of these people. And so what they did was they brought in just tax professionals who are willing to come and just spend a little bit of time to show them on that short form, where do they need to mark the boxes to make sure they were getting that tax credit. So it's a really good example of something that's totally not health related, income taxes. I mean, I don't know how many of you are thinking in the public health department, let's talk about income taxes, but it was a way for them to collaborate across those. And I think so in just in that example alone, in that piece of it, 6,000 women had participated. And now those participants are more confident about handling their money and doing their taxes, because once the tax part started, they started also doing some financial planning workshops in there, and it was allowing them to be able to take control of what was going on and gave them more disposable income so that they could spend that money on other things for their families. So what are those opportunities that we can do that? Where are those pieces of change that are coming for that? Okay, so, and there is also another handout that I just want to reference. It's called the Government Mechanisms and Windows of Opportunity. So how does the government work? Where are the levers that we might get into and push on? And what are potential windows of opportunity? So there is a handout for you to kind of look at later to go with that. And some more food for thought questions that are part of that when you're going to think about a particular policy project or strategy. Why is it important for health to become a part of the process or the discussion? And how are you going to explain this to other people? Who are the key leaders and how are you going to reach them? Who's for this and who's against it, right? When we talk about stakeholders, we also need to talk about the negative stakeholders. Who is going to say, why would we do that? It's going to cost too much money. What do we want other people to do? Do we want to invite them to the table, to the conversation? Do we need to ask them for help? Do we need space to have meetings, right? Again, with the health department, when they were having their WIC recipients come in, they had to either take a conference room or they had to go get a space from someplace else. They had to reach out to these tax professionals to get them to come and volunteer their time to meet with these women and sit, right? I mean, how can we get out there in that community, and who could we do that with? Do we need another a task force, right? I know in California, they actually created a health and all policies task force just to specifically look at areas where we could start to plug this in. And how can we just get to that? Are there human or financial resources that can help get work started or that can help sustain a project? What information are you missing? What do you need? You know, we know that an issue exists and we think we have some sort of vision for this, but what other information? How are we going to get that information? Who do we need to ask to get that? And do we know who those stakeholders are and what are their views? So you have this root cause map in your handouts as well. So this is, you know, the health outcome, here's where we are, and then we want to backtrack onto this root causes. Like if we can go back to here and go back to here, how do we keep asking ourselves what we're going to do? So this is just a quick example. So if we're looking at the root causing map, here's this example. Jason is a hypothetical child in a hospital. And this is the kind of causal chain that a root map cause would show. Why is Jason in the hospital? Because he had a bad infection in his leg. Well, why does he have an infection in his leg? Because he has a cut on his leg and it got infected. Why does he have a cut on his leg? Because he was playing in the junkyard next to his apartment and there was some sharp, jagged steel there that he fell on. Well, why was he playing in a junkyard? Because his neighborhood is kind of run down and a lot of kids play there and there's no one to supervise him. Why does he live in that neighborhood? Because his parents can't afford to live in it someplace else, right? Why can't they do that? Because his dad is unemployed and his mom is sick. You see how we're going back now to like, here's what he ended up with. This is the outcome. But how do we backtrack and start to come up with policies that could help never get to the part where Jason was in the hospital, right? So the root cause map can do that. So if we can look at like, where are we at? And this, the one I showed you here, this one is just a simple one. There's actually two that are in your packet of handouts. The other one is much more complex. So if you were taking something, this is just a simple one just to show you kind of the idea of what that's doing. It would just be a first step. So if there's an issue that you guys are thinking about that is impacting your community, you would want to put that in here, like, what is this? What is happening here? And now can you backtrack and ask the question why, right? And the age-old saying is, can you ask that question why? If you can ask it about 7 times, you'll probably get to the real answer. Okay, so about 7 is pretty much the norm for that. Okay, so let's talk a little bit about partners and the roles for this. So government partners obviously are an essential part of this health and all policies approach and initiatives. And it's important for us to think strategically about which agencies we can work with and who to include from those agencies. Health and all policies initiatives depend on champions, okay? So we're going to talk a little bit about terminology, champions and leaders, backbone people. Who are those people and how do we define that? So we have to have champions who are going to use their relationships, their visibility, and their organizational power to enlist the support of other key players. These initiatives also depend on governmental leaders to guide the development of a shared vision, help build and negotiate consensus, identify opportunities and priorities, and build support among higher level decision makers. Collaborative processes cannot work in the long term without backbone staff to help plan, manage, and support this initiative. You've got to have stakeholder involvement. Stakeholders are those outside of the government who are impacted by your work, but are not already partners in your health and all policies government initiative. They can help ensure that your health and all policies work is responsive and accountable to your community needs. And approaches to stakeholder engagement will vary based on the level of government that's involved, what your resources are, what are your goals, and what's the timeline, okay? So if we're thinking about who are we going to include, so we know that just by definition, health and all policies involves a wide variety of people and organizations across the government. Agency partners are absolutely essential to carrying out the work, as well as individual leaders in government who are going to spearhead the effort and lend vocal and visible support. Staffing, that's what we're going to consider this backbone team, are people who help facilitate the core operations of the group, okay? So when we're looking about government partners and who we should include, in lots of cases, a health department will actually initiate the collaboration with others or serve as a convener of that intersectoral work group. So whom you partner with is going to depend on your program or policy focus, if you have one, right? How your health and all policies effort is defined and under whose authority it is, what are your resources, and more. So you have to keep an open mind. So that's the first thing. It depends on your programmatic or policy focus. And then you want to be open-minded about who's going to be involved in this. So no matter what the issue is, there may be important connections to health that you haven't thought about, right? Again, we might not have thought about the tax credit as far as impacting our WIC recipients. And maybe if we did, we didn't think about a way to kind of connect with people in the community to have that happen. And so talking to people about what you want, you have this vision of things that you want to take care of, but then the more you talk about it with the people around you, the more everybody else has other ideas about, well, what about this? And what about this? And then who could we get to do that? And so you don't want to just start it and be like, let's go this route and focus just on this. We want to stop and think. And collaboration means taking a step back and keep being open-minded, and having more agencies at the table can allow for a more in-depth and nuanced understanding of complex issues. It can help us to generate a fuller complement of policy alternatives, because it might not just be that we have one good policy idea. Maybe we need to stop and think about, is this a policy issue or is it a program issue? Is it something that can be done at the local level? Do we have to have help from the state or the federal government to do so? Who's going to pay for it? Where do we get the money from? And if we can talk about engaging more sectors in discussions about health and create this momentum, we can do that kind of thing. Okay, so who can help us to get there? So the best thing we can do is think of something, start talking to people within our organizations, and then say, hey, what do you think? What could we do? Who could help us to do this, right? A lot of this, again, is throwing ideas around to one another so that we actually can make these comments to people, right? Let me see. I see a couple questions here, I think. And yes, Meg, absolutely BMI is flawed. And that's why I said we don't want to be going after that kind of thing. What we want to do is be providing people opportunities to have access to the things that will make them live healthier lifestyles, right? Like that's a health in all policies approach. But like we're saying, how do we get to this place? Like, what are the things that have been put into place when we move people away from small communities, when they don't have access, to fresh fruits and vegetables, when we have parents who are working multiple jobs and don't have time to exercise or to take their kids to the park? Like, what are all the different pieces that contribute to people leading less healthy lives? So that's absolutely the point of the health in all policies, is to come after all these ways. And so, and Terry, I see you may cover this later. And that's exactly the problem, right? And I said, that's what I said at the very beginning, was a lot of the things, when public health, you don't think of yourself as policy people, right, per se. That's what decision makers are for, and that's what politicians are for. And you're not politicians, you're public health professionals. But that's kind of the shift here that we have to make. We have to make the shift into thinking that you are policy people, right? You are plugging in because you can recognize what's going on in the communities, whether it be at local level or at the state level. And we have to remember this: people who are politicians that are making decisions that impact public health, most of the time don't know anything about public health, right? I mean, they're relatively clueless as far as making public health policy. So if we're not plugging in with them, we're going to get bad public health policy, because they're not going to consider health in the policies that they're creating. So, I mean, our idea of plugging in is to have to say, we have to work with them and be able to talk to them about, how do we plug in? We need better policies, we need better programs, and we need, obviously, and this is when we start to collaborate across sectors, that, because obviously we need money and they always give us less money. So what do you have to work with that, right? So as you mentioned, a lot of these issues are outside of the scope of public health as a government function in and of itself. So we have to learn how to get in there and start to advocate for these things and show them, like, look, if we do this, here's where this is going to come off as a win for you. Here's how it's going to come off with a win for your constituents and for our communities and for the pieces that we care about. Because again, policymakers are not typically well-versed in public health. They don't have the answers. They haven't done the work. They haven't done the programs. I mean, think about all the different programs that you have under the purview of the health department, and every single one of those people is an expert. They're all experts. All those people that work for that program, they see it. They see what's working, what's not working. Where do we need more access? So part of it is like learning to build a team of collaborators that can go to these policymakers and say, okay, here's how we can help to do this. Here's what we can do to work together with these 5 things. And if you make this policy work for us, we can get these things done. So that's what I'm saying. The idea behind it is relatively simple. It's the implementation of health and all policies that's difficult. And so, and I'll jump ahead here. One of the things that we have to think about, one of the promising strategies of health and all policies, is to start small. Eventually we want to be on that other side of that spectrum, where the politicians across the board, decision makers, whether it be at the health department or in your local community or at the state or the federal level, are thinking about the impacts on health when they create a policy, but we're not there yet, right? So how can we start somewhere small so we can start to see that this is working and move forward in the future, right? Yes, exactly. That's exactly right, Terry. Okay. So let's go. Where am I at here? Okay. Let's move on to facilitators. Okay, so some of the key roles that we have that are filling to facilitate this kind of thing, as I mentioned, champions and leaders, right? That's our first thing. And actually, Kingdon refers to them as policy entrepreneurs. They're like the people who have an issue they want to tackle, and they're just waiting for this opportunity to come up and make a change. So maybe that's not you in the health department, but who is? Who is the person in your community that is like felt super strong about something, and you know they're always coming in, they're always saying, we need to take care of this, and we need to make sure this is done. Like, who is that person who might be one of your champions? A champion is somebody with key relationships, high visibility, or organizational influence, like a county supervisor, a mayor, the governor, an agency director, or maybe some well-known community leader. It might actually be, you know, that super popular minister in town, right? Who can use their power to promote a health and all policies approach and enlist the support of other important players. Champions need not be involved on day-to-day operations. Like, this is like your really big cheerleader. Who's going to help you get involved? And so, again, I think one of the things, and it sort of comes up, the question that Terry had asked a little bit ago, is that the whole thing may not be run from public health perspective. Public health may be a facilitator or a convener to bring people together. Like, one of the things that we want to recognize is, how do we help our communities, right? How can we help our communities be healthier? That's what we're trying to do, right? No harm to our communities. And what can we do to give them the best possible lives they can have, right? For themselves. Like, are we giving them the opportunities to be able to do that? And where are those inequities? What can we do to lower the inequities? And so perhaps we're not making the actual change, but who are we recognizing that is out there that we could bring together that can make the change, that makes our jobs easier, because we're giving information where it's provided and providing a way to collaborate, and it may be a space to do so. Maybe we're running the meeting, but who is that champion? And it might be somebody in your health department. Maybe somebody is super passionate about a particular issue or policy area or a program that we could find a way to work with others within the community to make that happen, right? And so that champion, again, who's that person, right? And so they don't have to necessarily be involved every single day, right? But one of the things, a leader actually guides the development of this vision. So they help build and negotiate consensus, identify opportunities and priorities, and build support among high-level decision makers. Leaders require a combination of visionary ideas, authority, and pragmatic skills, as well as an ability to manage risk. Unlike champions, leaders need to be involved in day-to-day operations. Health and all policies requires 3 kinds of leadership. Okay, so you gotta have 3 different kinds. The first one is administrative leadership. This includes an understanding of how partner agencies work, their particular sensitivities, and how to build consensus and planning tools. So that's just that admin piece of it. Who's gonna be in charge of that? We also are gonna need scientific leadership. This includes an ability to make the case for addressing particular problems or issues and what policies are likely to have the best health outcomes, okay? So where's the data, right? Who's got the data? Who's in charge of that? And then there has to also be a political leadership. And this includes authority, credibility, and decision-making capacity. Like, who's that person? Who's the political leader? Who's the person who we can get to change the policy? Because as you mentioned, we're not changing policy, but we can work to change policy. Like, what is the avenue to creating that? And then we also have to talk about backbone staff. Collaboration requires significant time and resources, possibly beyond what your partner agencies will be able to contribute. So if you want to be successful, a collaborative process requires a supporting backbone team of staff who may take on any of the following functions. So maybe they are the ones who do meeting facilitation and consensus building. Maybe you've got to have people who can be your technology and communication support. The backbone staff may be data collection and reporting. It might be synthesizing research or drafting management of documents, overseeing projects, or seeking funding, right? Maybe we need somebody who's a grant writer that's going to come work with us. Like, what are the different pieces that we have to have that we can count on? So yes, we want this big person up here who's going to fight for this, who's got some authority, who's got, you know, who really wants to champion this idea. Who is in our leadership positions that we can say, okay, you guys are our go-to our piece point here, 1, 2, 3. And then who else is going to work on this task force, this collaborative approach that we can count on to do these kind of things, right? And so that might mean getting a grant funder. Do you have somebody who would be willing to give some time, you know, pro bono, or do you have the money to be able to throw to that? And then finally, even building and maintaining the relationship with stakeholders, because that can be difficult. How do we keep stakeholders involved? And what do we do when problems arise? Do we need to meet with the stakeholders as a whole? Or do we need to just go over and talk to the business owner that works down the street because he's the one that's really upset about this whole program or policy. Like, let's say, for instance, we were going to do some sidewalk work, which again, I'm jumping ahead, but let's say we were going to do that. Maybe the issue is that this business owner is afraid that it's going to impact his foot traffic to put in this new construction. So how do you go and talk to him and say, okay, but this is broken, and you have more people that could get injured trying to come into your restaurant, or maybe it's people who won't come at all because they can't get here. So how do you go and talk to that person? So sometimes maybe you just need a team of people that are going to deal with just the stakeholders. So this is a huge undertaking. I hope that's what you're getting from this, right? Like I said, it's not overly complicated in the fact that if we want to build healthy communities, we have to work on more than just public health, right? We can't just come at it from just the public health perspective. We're going to have to involve everybody else. But that is a really big deal. And that takes a lot of work and a lot of planning and a lot of discussing and including as many people as possible so that you don't leave not only like a business out or something like that, but also the groups that are not represented, like including those people and our stakeholders. How do we get those people involved so that we're not making policies and we're not creating programs that actually are not helpful to them because we thought we knew better and we didn't ask them, right? Asking the people who actually are the most impacted is a huge deal. And, you know, policymakers are terrible at that. How many times do you see politicians out in the middle of the public asking people about what they need, right? Not as often as they should be, right? Okay, so let's see. So who are our stakeholders, right? That's going to be a big deal for us as far as getting, this is going to be policy and issue experts. We got to start with those people, right? How do we know who the big people are, right? Okay. This is also going to include our community members and non-governmental organizations. Like I said, in some cases, you might find your church leadership is a really good community member-based organization that can help you to say, yes, I see that the people in my congregation are suffering from X, Y, or Z. Yes, you can use the space in the church to have your meeting to meet with people about this. Yes, I would be willing to come and talk to the people in my church to say, hey, let's get some of you involved. I want you to help out. Who can be the bridge for that, right? Those stakeholders are really important for us to be able to get to that. Who else is in the private sector? Like I just mentioned a minute ago, who are those business owners that are going to be impacted by what you're trying to do? And are they going to be on your side or are they going to be a negative stakeholder? And how do you get ahead of that? Because you want to do your best to minimize the negative stakeholders, right? Like that's a big goal for us. And then who are the funders? How are we going to get funding from these kind of things? Okay. So we want to make sure that we're soliciting this input from stakeholders because that's a key strategy for ensuring that our work is responsive and accountable to community needs. You know, we make this, we see this a lot of times in not just in public health, but outside of public health, right? An organization decides that they want to go, you know, like on some sort of mission trip or some sort of helpful, they want to go someplace and do some helpfulness, right? And so what you see is like they'll show up in a place and do like painting. They're going to paint the building or they're going to do this and they feel good about it, right? But what they actually haven't done is, you know, maybe what they needed were clothing. And instead you did painting because you weren't including the people that it actually impacted in that. And I think a lot of times that's one of the big things that we do is that we include the people who are making the decisions and the people who have the money, and we're not necessarily including the people who it actually impacts. And so who are these people? Who is involved in this? And how do we get to where we make sure we're including everyone? Okay, and why do we want to do this, right? We want to do this because they can help us. They can help us to create better solutions by providing information about barriers and opportunities for help at the community level and insight into the ways in which government agencies and policies may impede or promote health. We want to engage stakeholders because it helps us foster better understanding of the roles of different government agencies at local, regional, state, and federal levels, and the impacts of their policies and programs on community health and well-being. They can catalyze community action by promoting community participation in government processes. They can help us to garner support for this idea of health and all policies. I mean, if you were to walk down the street today even if you've heard of health and all policies for a while now, does the average person in your community know what that is? Well, how are we going to get people to create this and to believe in it if they don't even know about it, right? So how are we going to do this? So the more we involve people outside of public health, the greater people will understand that, oh, we could make these policies that are actually doing good overall, not just for our economics, not just for environmental factors, but because it contributes to healthy people in general. Okay. And so the more we can have that health concern, including any policy that's created for us, the better off we are. And to do that, we have to get outside of public health to do it. But public health is the one that understands it, right? You guys are the ones who know what the issues are. You guys are the ones who are working in these programs. You see where things are needed and what's necessary. So it takes, you are the experts. And we have to have you as the people who are going out into communities and saying, hey, let's work on these things. Let's do this together. Okay. And then this also, stakeholders can help us to facilitate development of these relationships among new partners, and they can help us to bring new resources and skills to the table. They can bring stuff in that we just don't have, right? And this, we also can increase this outreach to the information and sharing with our policymakers and the understanding of social determinants of health, right? So how do we do this, right? So if we look at the literature, like out engaging stakeholders, it suggests that partnership and stakeholder engagement are key components of successful health and all policy initiatives. The nature of that engagement varies widely. Some policy initiatives are formally composed solely of government agencies, right? So if you take just like if you create a health and all policies task force, perhaps that's just going to be the government agencies that are involved in that. But it may not be that. It might be something it's important for you to design a stakeholder engagement process that helps you get the information you need. You want to secure the buy-in and build credibility in the community where you hope to improve health outcomes. Part of it we've talked about, one of those big things about credibility, right? It's the lack of trust in government in general. We've seen a huge pushback to public health specifically in the last 3 years, right? And how do we do that? How do we get buy-in? We have to get out there. We have to get out in that community, and we have to talk to the people who are impacted by what we're trying to do and get their input on how to do that. We want to build that credibility. We want to be accountable. We want to be transparent. And, you know, sometimes there actually are the sunshine laws that mandate that certain activities or meetings are open to the public. So formal meetings and hearings can be intimidating or inaccessible to the stakeholders. I mean, how many times do you see that you have, you know, a public health open forum and who's coming, right? So how do you get to other ways to do that? Maybe it means that you need to go to a different location. Maybe you can't have people coming to the health department. Maybe you need to go to the school, or maybe you need to go to the community center. How do you do these kind of things? You want to identify additional means to engage these stakeholders so that you can get some really good feedback. And this varies over time. You know, some of you might consider posting information on your website or sending a note to an email listserv is adequate, but what you really want to do is be more engaged with that, because some agencies are reluctant to do this because of the required time commitment or the fear of being exposed. They might start, you know, that government bashing, somebody's a negative stakeholder and they're really vocal in an open kind of meeting, or because previous engagement attempts haven't really produced some practical solutions. So public health agencies as a whole are probably more familiar with community engagement than some of the other agencies. And so this is why it's a really good opportunity for health and all policies to be able to come out of public health. It needs to start in public health. And again, you're not necessarily making the policy change, but you have to be the facilitators of it. You are the experts and you are the ones who know your communities better than anyone, right? So how can we do this? Health and all policy stakeholders can provide this input in so many different ways. And that approach is going to vary depending on the decisions you're trying to inform, the timing of those decisions, and the availability of the resources, and whether you're seeking one-time or ongoing input. Outreach is critical so that interested parties are aware of opportunity for input and engagement. You want to work with colleagues and organizations in sectors outside the public health field to reach out to diverse stakeholders that address that huge array of issues in your collaboration. And who's it going to touch? So you might have to do some targeted outreach. It might be necessary to involve those who work with and represent those vulnerable and disenfranchised populations. So who can we be working with in the community to do that? It's essential to consider the perspectives and the needs and the concerns, you know, even in our rural communities. Like, are we engaged with people? Are we helping them? Have we met them where they're at? Is language an issue? Are we talking over their heads? Are we giving them just data and statistics and we're not involving them in like that we understand that this is an issue for you and what do you think that we could do to make this better, right? Are we thinking about how we can increase accessibility for youth and people with disabilities? Are we talking about our seniors? Are people connected by county, but there's not really any commonality, right? Is there not any really doing so many things, right? And I think here's the thing, stakeholder engagement might include some of these things. Maybe it's one-on-one discussion. I'll use that example again for the business owner. Maybe he's a negative stakeholder and you need to get him on board with you. So maybe you need to send somebody in there and have a conversation with just him. It might look like community workshops, meetings, forums, listening sessions, or focus groups. Maybe it's a webinar with a discussion feature, right? It might be a teleconference. Maybe it's just an advisory group. Maybe they're formal, maybe they're informal, maybe they meet once a month, maybe they meet at the beginning, or maybe it's every month. And then at some point, though, you are going to have some sort of public input periods, either at these government meetings or hearings. You want to know what the people in your community have to think, right? And again, for those of you who have done like community health needs assessment, you know that there's ways to engage with your community, but how do we do it? How do we invite them, right? How are we transparent and saying, hey, we want to address these issues in our community. What do you think, right? And invitations for written input. Maybe we just need somebody to give us some, what do you think, right? Maybe it's just a note and comment session. And also then we can also do the social media and other uses of online communications, okay? So if we want to think about this idea of engaging people of where they are. So an example from that handout is the strategic planning process at the health department in Monterey County here in California included significant engagement with the community. The health department used this engagement process to help boost support for a health and all policies approach. So the staff identified community groups, churchgoers, college students, elected officials, parent groups, and then they arranged to meet with those groups during their regular meeting time. But they wanted to ensure countywide representation. So the staff, that backbone staff that's super important, also tried to meet with at least 2 groups in each county district. So in all, they had 21 meetings over 5 months. And you're going, wow, that is a lot of meetings over a short amount of time. Then that's true. But if you have a bunch of different people that are willing to come together, it's not one of you running around doing 21 meetings, right? If you have a team, if you're collaborating, you can break that up. If you have that backbone staff to go there, you can actually get to those different meetings because you can send different team players to go do it. So they were wanting to get this sufficient input. They took a flexible approach to this input process. They arranged additional meetings when more information was needed. Meetings were arranged around the stakeholders' holiday schedules, like the kids, the college students, and some were arranged to ensure contact with migrant workers. Each meeting was formatted for length and content to fit the needs of that particular stakeholder group. So it wasn't the same thing. You didn't just show up. If you're talking to college students and then you're talking to seniors, you're not going to say the same thing, right? So you can't just be like, here's our message, send it out. You have to say, okay, who's the group I'm talking to today? And which one of our backbone staff, which one of our team players here needs to talk to them, right? Who is going to best engage with that group of stakeholders and what do we want them to say? And of course, the general message needs to be the same. But the overall piece of it, right, I think is the whole deal. So eventually, you know, this Monterey County actually was able to come up with a strategic plan that had a lot of buy-in because they had a lot of different groups that were at the table before they just came to that, right? So if you really want to be constructive with stakeholder engagement, you have to prepare. So there's another one of those food for thoughts is in there, like, what do you want to achieve? What information are you seeking? Are you going to collect feedback on existing programs? Are you trying to ask for things that you could do that are new opportunities? What are the barriers to making that happen? How do we do this? What connections do we want to make or maybe strengthen? Where have we had pushback from people in the past that we know of? And how do we address that before we try to move forward? Do our goals align with those of the community members? Again, are we coming at this like, oh, we're public health, we know everything? Or are we actually asking them, what are your needs? What are your concerns? How do you think we should go about this, right? And how are we going to use that information that we get? How are we going to provide opportunities for stakeholder input? And how are we going to ensure that stakeholders understand that their input is valued to us? How do we make them feel like they're heard and that their voice matters to us? So those are just some of the questions that we have. Like, again, those are in the food for thought. And how do we get there? Health in all policies really is a lot more of planning, talking, planning, talking, planning, talking, before we actually get to the part where we can do something about them. And there also is a handout besides those food for thought questions that's called the ladder of participation. And we can just kind of show that we can think about the steps of how that works together. Okay, so talking about working together across different sectors, what does that mean? So some of the key points for that. Working together across sectors can take lots of different forms, ranging from simply sharing information, maybe that's what we're doing, all the way to collaborating on new projects or adopting shared goals that are integrated throughout each other's work. So it might look like sometimes when you're like, if you're thinking about interagency collaboration, you've got to have strong relationships that are built on a foundation of trust, mutuality, and reciprocity, right? So that's a really big thing too. And we're going to talk about that in just a minute in a little more detail. And interagency partnerships are going to benefit from reaching agreement about an overall approach to collaborative decision making. Okay, so there's a couple really important points here in this section, right, about building these relationships. Because at its root, the whole concept of health in all policies means you have to partner with others. You have to collaborate with other groups. This cannot be something that's done just from within inside the health department. Working together with partners can take lots of different forms, maybe just from sharing information all the way to co-creating new projects, right? But when you're doing that, you've got to make sure about how to best collaborate, right? And so when we're thinking about this, engagement implies a more active partnership, including opportunities for partners and stakeholders to propose solutions. You want to consult with them. We've got to have some sort of information exchange, right? So, and you might not even be to the point where you can have that collaboration just yet. Maybe you're just at that part where you're starting to share information or you're consulting with them or other groups. Maybe you're engaging partners and solving problems. You can do that by building trust. Maybe it's just a matter of getting out in the community. Like, if you think about that, are those of you in the local health department, are you out and about in your communities as representatives of the public health department on a regular basis? Or are you, at work, and then that's only the people who come into the public health department ever actually see you? Like, how can we get out there to where we have a better face for public health within the community, where people know that they can come and talk to us if they have issues or ideas? Like, are we just being that public health representative out inside our community? So that's one of the things that we have to think about. Okay, so focus on building trust, right? We're asking individuals and agencies to move out of your comfort zone. So here's where you all tune me out, right? Where I say, get out of your comfort zone. Nobody wants to do that. Nobody wants to be putting themselves out there. Nobody wants to, they start working with the community and people are like, don't like that idea, right? Most of you have all unfortunately had the sad impact of COVID and people's pushback about everything you say to try to take care of themselves. And it doesn't feel very good right now to think about moving out of your comfort zone and working with new partners, right? But we want to do that. We need to do that if we want to move forward in the future and not just continue to have these policies that are not good for all of us in a whole. So we have to do this. So here's the problem though. Sometimes collaboration raises concerns about turf, right? Like, this is my project, this is our project, and what do we want that we're going to get that together? And so when you start intertwining groups, you're going to have loss of authority, and so are they. You're going to have not control over all the resources and maybe not even ownership of an issue. So sometimes we want to have to ask about that ahead of time. We need to be, give people opportunities, right? We need to do some of these things that are going to help us to build this trust. And one of those things is to practice humility. When we acknowledge that we don't have all the answers and that our perspective is not always the right one, others are going to feel more willing to speak up. Remember to be open to learning from everyone you speak with and recognize the expertise of other partners and acknowledge the differences of opinions. Everybody is not coming at this. That's a big deal when you're going to start to collaborate with people outside of the health department. The problem with that is that they don't have the same goal. They don't have the same agenda as you do, right? So that's going to cause some friction. And so if you can know that going into this, you can acknowledge that. You can understand that there are going to be differences of opinions. You want to listen and learn about and demonstrate your interest in the goals, in their worries, in their frustrations, in their hopes, and in their motivation. Why do they care? Why do they care about being involved in this project? Do they care? Are they a negative stakeholder? Do they not care at all, right? So one of the things, that we want to think is like remembering that we don't know it all, right? We see what we see, but we see it only from our perspective, and so does everybody else, right? So that's the first piece of it. The next thing is, while transparency and accountability are super essential, we've talked about that already, partners may need opportunities to air their concerns in a confidential setting. This can foster greater openness, which is so interesting, right? It's kind of a backwards thought. Like if you allow somebody to vent to you in a more confidential, personal space, that actually can typically foster greater openness above that. And because now everybody's willing to sit down and have a conversation because you've been able to deal with this issue over here on the side, right? And also this goes back to those sunshine laws. Be careful if you are doing collaboration and you're having meetings about certain stuff that can impact the community, double check what the actual law on the books are as far as like who has to be included, and that you're not having a closed door meeting that technically would fall outside the purview of what you should be doing without telling the public what's going on, right? And of course, you always want to just, honor the commitments. If you said we're going to help with this, it's important to follow through on that agreement you make. Or if it becomes to where you can't do it, you got to let your partners know and how the plan has changed. Another piece of this is to model reciprocity. So when we're talking about collaboration, you got to help each other out, right? And you want to be able to give something, and reciprocity sometimes requires shifting from a mindset of scarcity and competition to a long-term collaborative model. And I know that part is difficult, especially I think in public health, because all of your programs, public health, your department as a whole is under constant attack for like do more with less. And then even your own programs, several of you are wearing different hats, working under different programs, and you're, a little bit FTE over here and a little bit FTE over here. So that program can sustain itself. You're constantly worried that program might disappear or lose funding. It's really hard for us not to get very defensive and protective of that program or those policies that we care about, and to share some of those things with other people, and where it feels like we might lose some control or some resources can be a really scary place to start, right? So one of the ways that we can say is, okay, like, I'm going to help you, you're going to help us, we're going to work together. So how do we do that? Well, one of the ways is offering help. If there's an opportunity that comes up where you can help your partner, make an offer, right? Maybe this is just you giving them information or reviewing grants or serving on a committee. Or here's a good example, like maybe you have a summer intern that can go help work on the partner project for an afternoon. If you take the first step, then you can kind of create this culture of reciprocity, which is likely going to pay off in the long run, the more opportunities you have. So like, what can you do to make this to where they want to help you because you're helping with them? And the other thing is just simple, give credit, right? Sharing credit is really easy and doesn't cost anything and can go a long way in supporting your partner's ongoing participation and goodwill. We really don't want to get in the mindset of like, we came up with this, right? Group X, but there's, 25 groups here. We did this, or, what, so-and-so brought this piece to the table. Like, make sure people are feeling like if they're contributing something that you didn't just run away with it, like as the group. I don't mean you personally, I mean as in the group. And assume good intentions. And I think this one is really hard, especially if you're working via Zoom or with with maybe groups that you haven't worked with in the past, or when you're talking to policymakers, if you're talking to politicians, because here's the problem. Since we're so siloed in most governments, we live in a country that has a federal system, and, in a state of Montana, you're talking even more broken down. You've got local level, you've got state level, you've got federal level. So you've got all of these different tiers of government, and you're not only siloed in that way, but you're also siloed like within your own health departments and within your own communities. And so you're inevitably going to have miscommunication and some misunderstandings about any of the areas that you're talking about. So one of the things that you have to do is assume that they're not coming at this in the wrong way, right? And I think that's one of the key points is double check, ask a question. Don't let that misunderstanding get blown out of proportion, because if people are willing to come work in a collaborative effort for a health in all policies approach, it's probably because they want it to be better, right? So if there's a misunderstanding, get it out there earlier, and just don't make that assumption that this is, they're going after it the wrong way. And finally, on this, building these intersectoral relationships, we want to pursue mutuality. So this is the idea that our goals are aligned across agencies and across policy areas. It represents a really big culture shift from pursuing independent, topic-based interests to embracing shared beliefs and pursuing common goals. Because governments tend to be so siloed, health and all policy leaders and backbone staff have a huge role that you can play here in modeling this kind of behavior. As people see the benefits of having a common vision and shared goals, they will likely embrace this idea more and more. Okay, so this is really where public health is coming in. Like I said, you're leading the charge here. Okay, you want to do things like discover the shared values. Every person who comes to a health and all policies initiative brings personal and organizational values with them. Your group may have an easier time identifying shared goals if you have explicit conversations about values early in the process. You also want to identify those win-wins and co-benefits, right? This collaboration works the best when partners from all sectors can see some sort of tangible gain for themselves, okay? Because whether explicitly or not, many people that you approach are likely to ask themselves, what's in it for me? It's just the nature of who we are. And especially if we're going to ask a business or an organization or a community group to give up time or space or money or information, they're going to want to know what they're going to get out of that. So if we can identify things that are win-wins, we can help to establish this kind of buy-in. This will allow partners to leverage those resources and increase efficiency by pursuing multiple goals through one effort. And that's an essential strategy for getting this mutual vision and shared goals, right? So if we can think about it that way, so just a really quick example of this like win-win type strategy. So we know obviously climate change is huge, and it really impacts the direct impacts on our health, right? It's like heat, illness, or injuries from flooding, other extreme weather events, and sometimes indirectly, right, through food, water, air quality, and security. So there's lots of different strategies to address climate change, and they have important health co-benefits. So for instance, reducing greenhouse gas emissions from motor vehicles by driving less and walking and biking more can be a huge health benefit. But it also can increase physical activity, which could reduce cardiovascular disease or diabetes or other chronic illnesses. So maybe planting shade trees reduces urban heat islands and can also lower energy costs, which would then free up resources of low income people for other basic needs. So like, what can we do that is something relatively simple even that might have an impact across different groups and for different reasons, and maybe even contribute to more than one health outcome in the process, okay? All right, and again, this section also has the food for thought questions that are in that one handout. Then we want to talk about how you're going to make decisions, okay? So one of the big pieces for this decision making is, are you going to do majority or consensus? Now, typically, we think about majority, right? It's kind of the nature of the United States, right? Whoever gets a majority wins. So that's pretty much the ideas in our brains, right? But you're going to have to make decisions together, such as agreeing upon goals, selecting priorities, establishing commitments for specific action steps, and authorizing staff to carry out a project or make decisions on behalf of the group. Clearly, we want to be transparent in that decision making because that can help build trust among your partners, which is easier if groups agree on their approach to decision making at the start. So if you have now identified, let's say you have created this group, you're going to work on this, you know who your collaborators are. One of the first things you have to do is decide how you're going to make decisions as a group. Okay, and the approach, your decision making may change over time, but you want to talk about how you're going to do that. Okay, how are you going to do that? And so one of the big things that we want to talk about is the idea of majority voting versus consensus. Okay, these are both common methods of group decision making. Consensus is more likely to support the kinds of collaborative work in a health and all policies approach because it provides an opportunity to uncover underlying concerns and build solutions that meet your partner's needs. Okay, so again, while we think of majority, that's not necessarily our best move here, okay? Because our move here is to see how many people that we can get and what's really going on. So if we're talking about majority, the problem is this: 51% agree with it. Now you've got 49% that don't. Okay, and that's not good for us if we're trying to collaborate, right? Like that might work as far as voting goes, for the mayor, but if we're going to try to get a healthy community and we're trying to work on something, we don't want 49% of people to be against the decision that we're making. Okay, so this provides us an opportunity to uncover underlying concerns and to build solutions that meet your partner's needs. Consensus decision making requires that all group members either support or do not block a decision, rather than just the 51%, or in some cases, supermajority can be implemented, which is like 66%. Some forms of consensus ask each partner to reveal the strength of their support for a given proposal, which can create opportunities to further strengthen the proposals through the decision-making process. So let's see here. You have that, oops, sorry. There is actually a handout in your folder that shows the difference between majority and consensus, like what the impacts of that might be. And there's pros and cons to both. So it does, well, while we typically say consensus, you can see that there on that handout, it's not perfect, okay? Because again, you might end up with people, by the time you get to a consensus, you have watered down so much what you're doing that doesn't really work for anybody. So you want to make sure you're not at that stage either. Okay, so let's talk about structures to support a health and all policies approach. So here are some of the key points of doing that. So while health and all policies can have formal or informal structures, in the long run, the goal of embedding health in governmental decision-making is best supported by formal structures that are stable and foster long-term change. So while I mentioned before that spectrum, we might want to jump in over here. Our real goal is to change the structure to make this like a whole thing that is long-term change, but we might have to start over here, okay? So of course, this health and all policies initiatives require resources and may necessitate thinking creatively about sources of support. So how are we doing that? Notice our little stairs here: start, think, analyze, plan, try, do again, do again, do again, right? Like it's a constant evolving kind of thing that we need to think about. This is typically, we don't get so lucky that the first time we try to go do something that it totally works, right? While individual policy changes and projects can improve health outcomes and help build relationships with partners, a key element of this is that, a key element of this health and all policies is creating structure or procedural changes that support the consideration of health and equity. So we really want to make sure we're focusing not only on health, but on equity. Are we leaving any particular group out, right? And we want to make sure we're including them in the decision-making process across policy areas and over the long term. This is what we're calling embedding or institutionalizing a health and all policies into the structure and processes of government. With this approach, rather than considering health and equity after we make decisions, health considerations are embedded into the decision-making process. So they're at the beginning. We want to have this before it happens, right? So this is a radical shift in thinking about how government functions. And of course, it requires this collaboration across sectors. So it's important for long-term and sustainable impact because even in places with strong support for inclusion of health and equity, champions and leaders can leave, funding sources and policy priorities can shift, and circumstances can change. So if we're going to do this, right, we have to institutionalizing a health and all policies approach requires significant capacity building and a shift in mindset for many people in the government. And this is where you really come in, right? How do we get them to do that? And maybe this is one of the things that we can do. We can improving one project or program at a time. So analyzing a proposed plan for a new apartment building to identify ways to make it healthier may improve conditions for the hundreds of people who live there and who live nearby. Or we can change policy. Maybe we can change the current building code to require healthy design in the construction of all new multi-unit housing. That would impact even more people for generations to come. And then finally, maybe we are going to work on changing systems. Maybe we're going to incorporate a health lens into the process for changing the building code. Might have an even larger impact across a much broader range of decisions that include, but go far beyond housing. So all of these levels of change can promote health and may require multiple partners to work together across sectors. The level of change you decide to try to enact is going to be based on your consideration of many different things, like feasibility. In fact, a group, you might be able to do all three of these things over time. So think about what you and your partners are able to change and who you need to engage to make changes at the systems level. Okay. And then, again, questions you can consider about that. Is there a sustainable budget for your staff for this initiative? I mean, is this something that's going to last for 20 years? Or is it 6 months? Or is it 2 years? How can you do that? How are you going to build staff capacity? Are you having staff coming from outside public health fields? Are they trained in health and equity? Who are your health and equity experts, right? What overall strategies or goals and targets can be enhanced by the inclusion of health and equity? What government planning processes are there that are already in place? Can health and equity be incorporated into these legislative protocols? Where are the funding streams and how do they continue? Who do we need to get us to help to do that? Can we integrate health and equity into mandated requirements for guidelines or proposals or data sources? Like those are just some of the trying to come up with how do we make sure we're institutionalizing or embedding this health and all policies. And so it's a long-term goal, and there's lots of different steps along the way. And while you might find opportunities early, you'll also likely find it easier to get started in that kind of creative way. So this last piece here is creating healthy public policy. And I'm just going to briefly talk about this just because this is where we're going, right? It's healthy public policy. But we're talking about creation of public policy. That's a whole nother webinar and on the policy development and how do we get to that piece of the policy as far as policy development goes. But we do want to talk about these things. Many factors such as context, authority, participation, resources, all of these things come together, right? We want to choose what to work on and identify possible solutions. We want to define the problem and look for solutions. Now we're back to that root cause map. Let's build on what we already have. Like, what do we already have going on that maybe is addressing this particular issue? And how do we just build off that? We don't have to reinvent the wheel every time to have a health and all policies approach, right? And of course, don't forget, we want to establish our priorities because that's kind of a big deal. So here we go. This is some promising strategies. And these, they're, again, it's just what's been known in the research since we've been trying to take a health and all policies approach over the last 15 or so years as we make these little changes, like what are the best kind of ways that we can get this to work, right? Okay, so start small. That's small. So how can we do that? And so then we're going to find champions. So I'm going to go over the 5 of them, and then I'm going to talk about each one individually real quick. Okay. So we want to start small, find champions at partner agencies or health departments, develop measurements for success, prepare for the unexpected, which that's hard to do, is it not? And then finally, how do we get to that embedding institutionalization piece of it to where it's going to stick around even after partners that we currently have are gone, right? Like that's the whole goal. Like, is this still here next year, 10 years from now, 20 years from now, if it needs to be? And if you were the champion for this, is it okay that you're now no longer doing that because we've embedded it into here and we actually understand how this works? Okay. So accessibility concerns in Missoula. So I have full disclosure, and she has allowed me to use this for several different pieces. So I have a former student of mine who they actually were working on a project in one of my classes. And one of the things was to come up with something to impact their community. They had to create a community action plan. And in this, and I'm using, so she didn't create this project using for health and all policies is what I'm trying to say. Okay, so this is an example of a student and what they came up with. And I just want to show you, because at the beginning, we were talking about how do we sort of narrow this down? How can we start small if we are wanting to tackle that issue that we were talking about before and building healthy communities? How do we do that? And so one of the ways, which is really interesting from her, is her goal for this was to actually, she proposed like a 3-step proposal. And part of that proposal is to get the community aware and involved, which is a huge part of a health and all policy. So even though she wasn't particularly writing this with a health and all policies lens, it came out that way. So again, I put that in your folder so you could just see her research brief. So you can just, it's just one page and then her references. And this goes along within her community action plan, which was like a 30-page document that she eventually did. But you'll get the gist of like what she's saying here and how we could actually look at something like that. And this is a way for us to start small, right? So we might just look at, she's looking specifically at getting people involved, getting awareness made, doing some improvements, and getting some additional lighting. So that's not a huge, I mean, it is, but it's only one piece of something that could be being done. So who are the champions at partner agencies? So one way to do this would be to first identify any potential partners or stakeholders. So healthcare workers, public health officials, city engineers, construction subcontractors, because she's talking about sidewalks, right? And so who are these people? The parents, churchgoers, because she's talking sidewalks and lampposts. So again, which one of these people is jumping up and down the most saying these sidewalks are not working for us, we can't go anywhere, right? And here's the really big piece that I want to show you to make sure, and then we're almost done here. So she developed 6 overall goals for the term of 5 years. So her goals are SMART, right? So the term SMART goals, if you're looking at that idea, so SMART means specific, measurable, achievable, relevant, and time bound. Okay, so how do we do that? So when I thought hers were really good, this is why I wanted to use this as an example, because look what she did here. Improve accessibility awareness and disability etiquette in University District by 30% within the next 5 years. Now she's going to be able to measure that using survey results, but see how she's going to do this in the time frame, and it's 30%. Okay. The next one is actually training for urban planning for the future. So we've got 30 and using this 32. So you know you could measure that impact. The next one is very specific. She wants an installation of 13.16 miles of new sidewalks and renovating 9.62 miles of Port Affairs sidewalks within 2 years. So see, part of what you have to do is when you're thinking about this in terms of what the goal is for the group, did you write it down so that everybody understands what the goal is? If you're very specific, you've set a time frame, and it can be measured. Because the thing is, we don't want to just say, we want a healthy community. Did we do this? Did we get 13.616 miles of new sidewalk in 5 years? That is something that we can say, yes, yes, we did, or no, no, we did not. Okay. And then this 600 new lampposts in 5 years, she included, and increase the percentage of walking commuters in this district from 6.4 to 10%. So she already had that baseline number of 6.4%. So survey results over the next 5 years, can we increase that to 10? So that's how you can start small. You can be looking at those kind of things and get those goals. So number 3 on the easy things is develop measurements for success. So I would suggest 100% SMART goals so that you know what you're doing and everybody's focused on what's coming up. And then her last one was to improve perceived safety and barrier. Again, part of it is like physically doing things. Some part is attitudes in the community. So maybe that's what you're working on. And of course, preparing for the unexpected. Additional sidewalks may be an issue. Like maybe it comes up that there's other ones that become poor or in the next few years. So how do you deal with that? What about the cost of inflation? If you've made this construction habits you can do, maybe the weather comes up during construction. So like how are you going to prepare for this unexpected? So that's, you know, and of course we can only be so prepared for the unexpected. And finally, this last piece is organizational integration and institutionalization. Maybe it's changing the codes for identifying poor sidewalks. Maybe it's codes changes for future projects, and maybe these could be citywide, not just for the university district. It's a place to plug in and start small, but they could eventually go to all neighborhoods and all areas in there. So it's just, you know, again, this is just a way to start off with one little piece and then be able to do this in the long term. So that's it. We made it right there.